I'm just going to take you through a little bit of context to where this piece of work fits within TLAP and why we're holding today's session. So it all links back to a project that TLAP and Sky were commissioned with the aim of looking at how do we better equip local authorities' processes to encourage and support more cooperative and community ownership of social care. And when we say social care, there's a specific focus here around home care provision. And that was a commission from People Biz and Co-op UK. And that led us to create a community of practice where between 10 and 12 local authority commissioners in the main and also transformation leads met to talk about their own experience in terms or interest or challenges and opportunities around cooperative and community ownership, social care. We had 4 or 5 sessions of that community of practice, which led to an interim report, and I'm going to share some of the key findings from that in a moment. And then we felt that really opened it up to a webinar series and to bring more people in, because there's clear interest, and it's great to see so many people signing up today, but also previous events shows that this is something that really taps into an area of interest in commissioning. What comes next will be a final report and some supporting resources. So local authorities and commissioners have some of the information that they need to take the first step. And then when the project itself finishes, we'll be incorporating this within a business as usual, within Think Local App Personal, linking it into an innovations work stream, because we think there is a lot here that we can do some really interesting work with, linking cooperatives and community-owned social care models with commissioning. Joe, can I have the next slide, please? They're going to share all these slides. I'm not going to run through every bullet point, and I'll make sure that you have all the information, but I think some of the context for the community of practice would be helpful. So what we heard in terms of the motivations, why community owned or cooperatively owned home care, why is that of interest and why is that of value? And that we heard from the people in the community of practice, there's a real desire for change, but it's often linked to wider strategic goals, looking at inclusive wealth building, a desire and a need for more personalised holistic support, drawing on linked communities delivering more locally and well integrated provision. It's seen as a way of expanding the prevention and early intervention agendas. It's able to better meet and reflect diversity of the local population in a way that some of the block contract commissioning of home care struggles to. And a real desire to move from hours to outcomes, trying to offer people greater flexibility, and also recognition that this could be a way of also addressing some of the issues with workforce and well-being. Can I have the next slide, please? So the reason why people sort of are looking towards cooperatives and community-owned models are really sort of come down to these from the community of practice. We're looking at creating more choice and diversity in the market. Covering places not currently well served. So are there gaps and niches in the local population that are something that's much more rooted with local people and local populations could meet? Are there people that aren't very well served? Could this be a way of extending choice and incentives for people to have direct payments, also better offers for self-funders or particular groups who aren't particularly well served from mainstream provision? Again, I've made the point previously around prevention, early intervention, but really looking at, is this a way to get beyond just having personal care to genuinely supporting people to have a life? And there's a lot of interest here, not to look at co-ops and community-owned care as its own thing, but to see this within a broader look at how we diversify social care provision and linking that to the micro-enterprise development that many of the councils in the community of practice were also interested in. Next slide, please. There are some barriers, clearly, to making significant progress, and that's really the main focus of the community of practice in these subsequent webinars. So there aren't a lot of people out there demanding community-owned cooperative care, so there's no incentive from the consumer end, sort of championing and demanding this from local commissioning. There's the supply of social entrepreneurs isn't there. There's a concern about the cost concern about complication, particularly governance, and how hard it is to explain the cooperative movement. And again, even if you're buying into the why and understanding what this is about, is then how do you then begin to get that off the ground? These are some of the questions and challenges. Next slide, please. In terms of supply and barriers, lack of funding for incubations, how do you move from block contracts that deliver care at scale to some of these more niche personalized support offers when there's demand from people, but also limits to funding and supply? There's some concerns around fair competition, compliance and procurement rules, risk of damaging relationships with others in the market. And contracting systems themselves aren't designed necessarily for supporting this kind of provision. And then there's a question and a challenge about whether you make or buy. So to make is through supporting creation of new local organisations, diversifying existing organisations, or buy it in, which is really about attracting existing co-ops who may wish to grow. Next slide, please. So what we were hearing is things that would help is ideas to how we can create the space for change. It's not a switch that you can flick. It's about creating the conditions and getting the engagement and the buy-in. So there's certain things that were identified as being helpful for a local authority area to be ready to begin to move in this direction. So the focus on strength-based practice and person-centered approaches, use of direct payments, individual service funds, co-production, which is the subject of today's webinar, working with people on strategy and the models and the services being provided, asset-based approaches, asset mapping, knowing what you can draw on in your local area and who the key people who may be interested in engaging and doing things differently. The role of digital technology for the businesses themselves, but also the people, and the importance of integration and partnerships to really make this, this come to life. Next slide, please. Things that could help around strategic commissioning compared to service-based commissioning, support from other parts from the councils, having incubator funding, making sure they're easy and your systems are easy to do business with, to sort of really attract the entrepreneurial spirit and innovators. Need appetite for decommissioning and also availability of research on effective home care. So what does good look like? Which I think co-production is going to be a big part of feeding into that. Also questions around workforce. So capacity and turnover within organisations makes it difficult sometimes to carve out the time to think and act, because this does take time and consistency. And also shortage of care workers and recognition that new forms of provision won't automatically solve that. But also the opportunity that it could provide an attractive alternative. Next slide, please. So I'm going to hand over to Jennifer and Kate now, who are going to have a session describing co-production. So make sure we're all on the same page when we talk about that term. So I don't know if it's Jennifer or Kate kicking off. So just come in.
Thanks, Ian. I'll just wait for the slides to come up, but just while that's happening, I'm Kate Perudis. I'm the co-production advisor at Think Local, Act Personal. So we're a partnership organisation funded by the DH, but we have a load of partners that we work with, central government, local government providers and commissioners, all seeking to make personalised care and support a reality. And I'll be talking a bit more about how we do that as our little slot goes on. I have been doing co-production since before I knew what that word meant, and I'll be defining what we mean by co-production in a moment, because I think it means different things to different people depending on the context. And then we'll be talking about some examples in practice. But just before I kick off, I'm going to hand over to Jennifer, who's a member of the National Co-production Advisory Group, who's a group of people with lived experience and carers from all walks of life that we shape and increasingly kind of co-produce our work with here at TLAB. So over to you, Jennifer, just to introduce yourself.
Hi, I'm Jennifer Pearl. I'm somebody who uses services. What you can't see is I'm in a wheelchair. I've got a non-traumatic spinal injury, and I heavily draw on health and care provision. I've got lots of different hats that I wear. Obviously here I'm representing the National Co-production Advisory Group. I'm co-chair of a deaf and disabled people's organisation locally, and I'm also an expert by experience for the Care Quality Commission. Thanks.
Thanks, Jennifer. So right after we talk about the definition and what we mean by co-production, we're going to think about why and the benefits of co-production and what they bring. And then we're going to be talking about the values or the ingredients that you need to make good co-production happen. And then it's going to be an informal question and answer session between Jennifer and myself, talking about her experiences of care and the difference that a co-production approach made in work with her provider. So we'll just kick off with the next slide. Thanks, Joe. So in terms of what we mean by co-production, this is a definition from the National Co-production Advisory Group. And it's a way of working where everybody comes together on an equal basis to create a service or come to a decision which works for them all. And it's based on the idea that those who access a service are best placed to design it. So in practice, what it involves is people who access services are consulted, included, and they work together from the start to the end of any project that affects them. And that's quite important because it's very important to bring people with lived experience in at the start, the ideas, kind of the formation of a project or an idea. Sometimes it's called this kind of blank page approach, which in reality is quite hard to do. But just before an idea is developed, bringing people with lived experience in and thinking about how they can shape and actually implement a project or a service, as well as at the end evaluating to see whether it's succeeded or done what it set out to do. And when it works best, it's people who access services are valued by the organisation as equal partners with professionals. And what that looks like is this sharing of power between people with lived experience and the professionals. So it breaks down a kind of this thinking about professionals as having all the solutions and the answers to a way of working which is more about coming to shared solutions and agreeing shared goals and shared outcomes. And it's important to understand and explain how people with lived experience can have an influence over the final decisions that are made. So just take me to the next slide, which is the why of co-production. Thank you. I'll come to that picture in a moment, but I'm just going to talk through the bullets on the right first, and then I'll come back to what that picture means. So in terms of why should we be co-producing? I think a lot of people on the call already signed up to this, but it's just acknowledging that people are at different stages of their co-production journey. And sometimes it can help there's still a lot of influencing that goes on, particularly in big, complex organizations where some people are really, really happy to co-produce and others are kind of not really understanding why. So this can sort of help to bring people on board. So it helps to ensure that services are genuinely working well for people and drive demand for good and better services. It can keep people who draw on and are responsible for services committed and motivated to make sure there are tangible results. So just to kind of summarize, that means that sometimes services appear to be working, but having the people who've lived experience on board can actually check in and offer that kind of reality check angle to see how things are working, and if not, why not. When you're co-producing well, there's a feedback cycle. So services know what's working and what's not working in real time and can do something about it. Priorities can shift together and plans can change because there are these ongoing conversations and there are mechanisms by which to have those conversations with local people. It also makes people feel part of the community and part of the service and part of the system because they are creating change and working in partnership with professionals. And because of that, it increases accountability for decisions and actions. And doesn't mean that when you're working with people with lived experience and carers, you have to do everything that's said. It's just about if services can't react or change quickly, just having a conversation about why not, and thinking about, as I said, shifting priorities and budgets in line with what people actually want. And it means that services are more likely to be right the first time. So there isn't this retrospective undoing of bad policy or bad practice or bad services. And it can save money in the future. So while there's an outlay of costs at the start, because you're setting up good co-production infrastructure, the idea is that eventually this will catch up and lead to more cost-effective services because they're actually meeting need. And then the picture on the left refers to this trial that town planners used. And I stole this from our chair, Clinton Farquharson, who some of you will know. And you'll see it's this thing called desire paths. And it's a metaphor for user experience and design. And basically, before laying down concrete bricks, town planners used earth to see which path people preferred. And that slide shows what happens when designers or planners speed ahead without thinking or taking into account what the citizens' experience or their preference is. So you'll find a way to kind of use the path that you want, but actually that doesn't, you know, there's always been lots of money and cost and resource put into putting bricks down on something that people don't want. So that can be a helpful way to think about it. So just taking us to the next slide, please, Jo. It can be helpful when we're approached by local authorities. We're often asked, okay, so how do we do co-production? What we'd like is a big checklist about kind of the steps that you work through. And it doesn't really work like that. And more, as I said before, it's more of an approach and a way of working. And maybe a more helpful way of thinking about it is, what ingredients or values do you need to create the right conditions for co-production? And the first one would be equality, which is this understanding that everyone has something of value to bring to the table, regardless of whether they're a professional or a person with lived experience, a carer. Your lived experience is unique to you. And then this brings us to the next kind of value, which is about diversity, recognizing that having different types of people on a table, I mean, there are different skills that can be shared, and increases the possibility at arriving at new perspectives. The next value is accessibility. Excuse me. What's stopping people being around the table? What are the barriers to having this diverse group of people, and how can they be removed? And a key way around this is allowing time. So recognize you want different people around the table. Well, how are you going to reach them? How can you tap into networks that already exist in the community? But also thinking about allowing the time and money resources to overcome barriers that people might be experiencing, whether that's having meetings at certain times, whether that's providing costs for childcare, translation, having materials in an accessible format. And it doesn't always have a cost. It can just be about thinking about reworking slides and the language that's used, and allowing time for that to be translated into a language everyone can understand, to allow people to participate and fully understand. And the final one is reciprocity, which is a bit of a jargon word, but it means if you put something in, you get something out. It's about rewarding people for their time. So having proper payment policies, which we can maybe come on to later on, if that's something people want to know more about. How are you going to reward people for their time? How can you work with finances to overcome certain barriers to paying people who are not staff, and supporting people if taking part will affect their benefits? How can you overcome that? So it's not a toolkit or a set formula, it's a way of working and a way of thinking. And then the next slide, just very briefly to summarise this ladder of co-production. Just going to briefly take you through the different ways that you can work with people with lived experience. It's useful to think about it as a long-term relationship. So the bottom two rungs are about sort of just bringing people in, people not having real choice or control, but just being maybe forced to accept a particular decision. Educating is about people who use services helping to understand so they can gain knowledge, but that's still very much in the grouping of, on the right, doing too. So it's basically trying to fix people or who are passive recipients of services. But moving up the ladder, sort of closer towards co-production, is the middle three rungs, which are informing. So people responsible for services are informing people about how they work, explaining decisions, but it's still quite one directional. And the consultation is people asked to complete surveys or attend meetings, but again, have no influence over final decisions. Engagement is, again, moving closer to the right direction towards the golden thread of co-production, but like consultation, people might have more opportunities to express views, and there might be a chance to influence some decisions. But co-design is about people who use services being involved in designing the service, and they might have influence, but only at certain points, not involved from the start to the end, as I mentioned earlier. And co-production is people being involved from the start to the end as equal partners. Time, structures, support is built in to allow people to design, co-deliver and evaluate a project or a service. So I'll just pause there and just ask if Jennifer wants to add anything before we start to have a bit of an informal Q&A.
I think if we just go on to our little questions. Okay.
Great.
So Jo, if you can stop sharing the slides, please.
Great. So Jennifer, you've you have a regular domiciliary care service that's an essential part of the care and support that you receive. And I guess that enables you to lead your life independently. And I know it's not from a cooperative or a community business, but are there any features of the service that you think are relevant to developing more of this kind of service or provision?
Yeah, I mean, it's a small service. They don't take on big contracts. The owner I spoke to in preparation for today, and it's a message he said time and time again to me, says it will be the death of him if he takes on a local authority contract. So he just takes on bespoke packages or complex packages like mine, for either from health or from social care or private clients. The other thing is I have a small team of 5 carers that come in. So I deliberately didn't want to go down employing my own PAs because I spend every week at least 4 or 5 hours doing other sort of admin related to my health and care. So I didn't want that responsibility, certainly at the moment. I wrote my own care plan. I did that in conjunction. Well, I had a pro forma from the Spinal Injuries Association, and I had some advocacy support from them. So I wrote what I do, and I had physiotherapy input. And that was me being proactive. So I got the physiotherapy and the physio assistant to train all my carers into my stretches, and I have support boots that I wear, that sort of thing. So I did that. I accessed specific things about spinal cord injury that I wanted the carers trained in, so the owner did that. I never ever have anybody come to my house who hasn't done at least 2 or 3 shadow visits first. And that's the ethos. It's not just for me. That's the ethos of John, who runs the agency. He just won't do that. They respect things like, I want a female carer. Out of the 5, there's one that isn't quite as good. She's fine. She's good compared with. So I get her less. And when I've got 2 who are nurses back from their home country. So if I need something specific help, even just sorting my medicine cabinet out or something like that, I can ask. So that works better, and I've got flexibility. So if I needed an early call, certainly the mornings work well, but not everything works ideally. So I think that was most of what I wanted to say about flexibility and small, and also taking account of the carers and what fits in with their lives, what fits in with the obviously what the agency needs to run a business.
And you're still experiencing some barriers around particularly the service that you get in the evenings. Do you want to say anything about the choices that you have?
Well, I don't. I mean, I knew that I didn't have a choice when I what was clinical commissioning group, as it was then, suggested the agency, and I also phoned around in the area, and I spoke to a couple of people from the Care Quality Commission, inspectors in my area, informally, to find out if there was anything different. But all the care agencies are their last call is around 8 o'clock in the evening. So the only way that I would be able to have choose exactly what time I want to go to bed, because I'm sure if I asked, I've asked a few people and they say, if I asked you what time do you want to go to bed, well, you probably don't know, and you probably don't know until you want to go into bed, whether it's 10:30, 11 or whatever. So unless you have a live-in carer, you're not going to get that sort of time in the evening. And even with a PA, which I was talking about with my colleagues who use PAs, you're not going to have that flexibility unless you have someone who lives in your street or a couple of streets away, who you can just text and say, I want to go to bed now, because they obviously have a family life. So that bit doesn't work. And I suppose being in a wheelchair, I'm quite often ready to stretch out a bit earlier than I would have been before, but I don't have a choice. And if I want to go out late, then my husband has to do help me get into bed and do my personal care. So that bit doesn't work. And when I've talked to fellow wheelies, it seems to be the case. So the only way you have a real choice is if you have full-time care, which at the moment I don't need, but at some point I might well do. So that's a bit that's not ideal.
And you also said to me that you wouldn't want to put that on the carer, in terms of them having to make, travel a long way home. If they had to come to you late in the evening, they'd have to come back early the next day, and you're just conscious of that as well.
What I don't like about the present system, and again, I've had lots of conversations, and I'm sure you all know how it is, that all my team of 5, they work long days to get the amount of money that they need, and also that's the system with the care agency. So they don't get a different amount if they work late. So they work, I don't know, my normal call in the morning starts at 7:30. They may have been to a call before, or I sometimes get a 7 a.m. call. So they're working 7, and then my last call will finish, give or take, at 8:30 at night. So they're doing that quite often 6 days a week to get the amount of money that they need to earn. And they don't always get a choice of what days off they have, or the days off get changed because someone's off sick or something's happened.
Sorry, Jennifer. Yeah, I was going to move us on to the next question about the National Co-production Advisory Group and other work that you do more generally. I'm just conscious of time, if that's okay. So, as a member of TLAP's National Co-production Advisory Group, and you're also the co-chair of Inclusion Barnet, which is your local disabled people's organisation, so you're quite active in trying to improve services that people get. Can you tell us of any experiences, good or bad, of working to improve services?
It's very similar with both wheelchair service and equipment provision. The one I've done locally is I've had an absolutely appalling service from wheelchair services. It's been absolutely dreadful, and I could talk for 2 hours about how dreadful it's been. But it accumulated in me going to the North Central London Wheelchair Forum and talking to the director, and getting nowhere. And it took 6 months to get a new wheelchair back, 6 weeks to get batteries replaced on my wheelchair, 3 different engineers after I practically lost it with the director, came to my house 2 days later with the wrong set of batteries 3 times and without tools. So I made it my business to find out who the commissioners were, both in Barnet and for the whole of the integrated care system. And I arranged meetings with both of them. I'm vocal, I'm able to do that. Many of my sort of people I've met on my journey are not, they don't have the energy or ability to do that. And I wasn't just talking for myself, because so many people have had a bad service. So the commissioners are drafting the specification for May 2024. So I've been involved in that process, and I wrote a piece about my terrible experience, which is not dissimilar to many other people. And so they've taken a deep dive into that, and they've got 1 year more of the contract that's running, trying to make some changes. I think that's partly poor commissioning, poor company, and change in population, and poor service from suppliers, and shortage of bits and pieces from suppliers, and shipping problems. So I really feel that that's something that's made a difference. We've done a similar thing, not in my area, but I had similar problems with community equipment. And I had the opportunity through Think Local Act Personal to work with Mediquip, who were looking at co-production throughout England, and identifying what the problems were in the system and seeing what could be done. So, yeah.
And you were saying that you were talking to them about rewarding people, sharing their expertise and ideas, and some of the work some of the work they do is limited because of what they're commissioned to do. So you were talking about it being quite time consuming, difficult to get items on the list.
Yes, that was, we were talking about something called special. So any piece of equipment that isn't standard issue. And it seemed to be a problem up and down the country, and certain boroughs have certain things on their list of specials, like something called a sliding board, and others don't. So it was looking at particularly specials, I don't know what sort of, I don't know, like my shower chairs are special because it's padded, and how you can get around that.
And you were talking about how co-production needs to involve people who draw on care and support, and providers and commissioners all working together in order to kind of share that expertise and overcome some of these barriers. And you wrote a blog about wheelchair services and good commissioning, and I'm going to just dig that up and put the link in the chat. But I'm just aware of the time. We've just got 2 minutes left, Jennifer. So I'm just going to ask you, as a disabled person, you're expert in what works for you and what doesn't. For anyone thinking of setting up a care cooperative or a community business, what advice would you give them? What are your top tips?
To involve people right from the beginning, with different needs, because obviously we're all different, to pay carers a decent wage, and to give them the same, I'm not saying 9 to 5, but giving them a 36-hour week that people can actually live on a decent wage.
And you were saying it's taking the time to be clear and communicate maybe what the benefits of developing co-ops or community businesses might be, comparing it with existing provision. And then you're also saying about being a small organisation allows them possibly to develop a bespoke service that works around what the person needs.
Yeah. And just to have the person at the centre the whole time, and to keep on checking and reviewing how it's going, because obviously people's needs, people's preferences may change.
Okay, we'll pause there. We'll get some questions from everybody else in a moment, but just hand back to you.
That's great. Thanks, Kate. Thanks, Jennifer. We've had some really good questions, actually. Just in terms of time management for the session, what I'm going to do is move straight into the next part of the session with Jonathan and Graham, and then we'll combine the co-production specific questions with the co-production questions in the co-production at the end. Sorry, in the Q&A at the end. I think it's likely we're going to have more questions than we're going to be able to cover in the time allotted, but we'll make sure that we go through each of those and have a Q&A document that comes back out to everybody afterwards. So thanks, you certainly sort of stimulate a lot of thinking and a lot of really good questions. So thank you very much, both of you. Next part of the agenda, I'm delighted to welcome Jonathan and Graham, who are going to be looking specifically at co-production in relation to it being an essential ingredient, essential building block in the development of cooperatives and community businesses, and sharing their insights and their experiences. So I'm not sure which of you are starting. So I shall, Jonathan, so the slides are up. So over to you, Jonathan. Thank you.
Great, thank you, Ian. First of all, thank you for having me to talk about what we're doing. Now, I'm going to be following my notes, and Joe's going to control the slides for me. So I will have to ask people to ask her to move the slides on. So it's really good to have an opportunity to talk about what we're doing in Kirklees, and how we're supporting cooperatives generally, and specifically how we've supported the cooperative care Colne Valley. And how that fits entirely with our approach of People Partners Place. I'm going to talk a bit about wider co-production as well, so you can see where that fits in. It's on the next slide, just to help people understand where on earth is Kirklees. I know before I came and lived and worked here, I didn't know. So we're right slap bang between Leeds and Manchester. We're actually the 12th biggest district by population, which means that we've got a huge amount of diversity across those different places that make up Kirklees, and we've got big challenges as well. So on the next slide, we've got our shared outcomes and approach. So our work is guided in Kirklees by what we call our shared outcomes. Adult social care is primarily about ensuring people are well and as independent as possible. Shaped by People was a later addition to the outcomes, reflecting the need for all of our services to be developed based on the needs of our residents. I normally don't include efficient and effective when I talk about our shared outcomes, as this is really an internal outcome for the council. But actually, it's important to be clear that when services are shaped by people, that does make them more efficient and effective, because they're services that residents want to use and genuinely meet their needs. Our people partners place approach is also really important here. We've already seen the difference in presentations before between doing with and doing to. It's really important in our work that where possible we're doing with and making sure that people are really involved in designing the services that they benefit from. Moving on to the next slide. When we talk about cooperatives in Kirklees, this is really part of our inclusive economy programme, or inclusive economy approach. The work that we've done on this since 2018 follows these 8 areas that you can see on the screen. I won't go through them all, but when we talk about developing cooperatives and social enterprises, this sits within the grassroots theme. But it's important to see it in that context. And worth mentioning, we have got spend for local impact there. So when we're talking about council commissioning care services, we want to make sure that as much as possible that spend is impacting locally, but also good employment. When we talk about cooperatives, we know that they should be delivering much better employment for those that work for them than many businesses are able to do. So moving on again, so why a care co-op? Actually, Ian covered a lot of the points I've listed here. We want to support co-ops in multiple sectors, but we know that there are structural challenges in the business models in care. Again, many of the points have been mentioned already, so I won't labour them. So we believe that co-ops really positively impact on their workers and those benefiting from the goods and services that they provide, but also have benefits beyond that to their communities. And also because of the way that cooperatives work, they're more likely to benefit our environment as well, which is really important to us. Co-ops by design inherently are shaped by people, and ensuring in this case that those giving and receiving care have influence are not done to but with. Connecting this back to our shared outcomes, this should mean recipients of care are more independent. Now, the council has a specific responsibility to ensure self-funding residents have access to an adequate market of care providers. Ian referenced this. This is what really provided the opportunity for us to intervene and support the care cooperative. And at the same time, Kirklees Solidarity Economy Network that Graham's involved in were keen to develop something in the care space. I'm not going to go into huge amounts of detail on how the co-op does co-production. I'm going to leave that to Graham to cover. But just to say the supports that we provided to getting that off the ground involved both some financial support, though in the grand scheme of things, I don't think that was a huge amount, but also we seconded over a member of staff to support getting through the CQC registration process. As I said, I wanted to put this in the context of wider co-production work. The biggest piece of work of co-production that I've been aware of, and I meant to say earlier that I'm not the expert on co-production in the council. I leave that with colleagues, but it's really important to see how this fits with the co-ops piece of work, which I'm much more involved in. So we co-produced our adult social care vision, and this is where all of our services in adult social care should be starting. Our vision is fundamentally about people, partners, place. we've got a list of points here. It's about equity, social justice, and respecting people's rights. And again, I won't go through all of those details because I don't want to take up our time, but you can read them there and they'll be shared in the slides. But I think what I've pulled out on the right hand side at the heart is about not doing 2 people or 4 people, but working with people and with partners in ways that reflect the different places in Kirklees. And then we're doing more co-production work. We recognise that actually we need support to do this effectively. So we've got paid membership with groups and organisations, including Sky, that can lead engagement opportunities and help us to do that well. We're involving care and service user groups to participate in partnership boards, and also make sure that there are standing items on other parts of the governance structure. We're reaching out to expert self-advocacy groups. So there's a number of areas where we're working really hard to make sure that this goes through everything we're doing and isn't a piecemeal approach. Now, that's it for me, and I'll hand over to Graham, who can talk through a lot more about the ins and outs of the co-op itself.
Thanks, Jonathan. Good morning, everyone. If I start coughing and spluttering, please forgive me. I'm just recovering from a dose of something horrible. So I'm going to talk to you briefly a little bit about our experience really establishing and running a small cooperative care organisation in Kirklees. It's really interesting being invited to speak at this event, because I didn't really know much about what co-production was all about. So I found that useful, doing a little bit of homework on that. This is a screenshot from our website. So you can, it sort of speaks for itself, I think, in terms of our stance on this sort of stuff. I think it's worth saying right from the get-go that when we established the organisation, we designed it and we sort of established the process in such a way as we could be highly replicable, because we wanted what we were doing to be really quite small and sort of locally focused. And we probably, I guess we sort of knew right from the beginning that it was going to be quite difficult, because it was quite a complicated thing to get into. It's not like setting up a bakery shop or something like that. You know, it's more, there's a lot more complexities involved in it. So we were lucky enough to get a bit of support from the Power to Change Foundation to help us sort of write down our process really and our journey as we went through those sort of early years of setting the thing up. So we are a replicable node, if you want, and our vision when we set up and which remains our ambition, is to be part of a network, a federal network of care cooperatives across the country. And we've done some, some work on that, and a lot more needs to be done, but we know that there are others out there. We've spoken to quite a few, and we're keen to keep that conversation going and developing. So I did a bit of homework to find out a bit more about co-production, and I was surprised and pleased to learn that the term was first described by Elinor Ostrom back in the 70s. And for people that don't know Elinor Ostrom, she's a Nobel Prize-winning economist who's probably most famous for her work on governing the commons. People might know that old saying about the tragedy of the commons, and well, Elinor Ostrom's work destroyed that myth essentially, and that plays very fundamentally into what we're doing and how we operate, because I guess we see care as a commons, and we're participating in building that commons of care. Only, I think, certainly up until the sort of mid-late 20th century, if you spoke to people that were involved in the cooperative movement, they would talk about in terms of creating a cooperative commonwealth. So from where I'm standing, and I've been involved in the cooperative movement for most of my working life, then I'd say that cooperation and co-production are very, very similar things, if not the same thing, just with different labels on it. So we've been really interesting to look more deeply at the commonalities across there and see how cooperative values and principles can be applied to the benefit of co-production methodologies. So there's a strong common history there. So this session, as I understand it, is about commissioning and how we can use these ideas of co-production more effectively. So I started to think about sort of co-production across the supply chain and how that might manifest itself most effectively, and what we can do to improve it. So as a care cooperative, we're a multi-stakeholder organisation. Okay, so the people that work in the cooperative are members, can be members. The people that we provide care services to and with, they're members as well if they want to be. It's a voluntary thing, it's not compulsory, but obviously we encourage everyone to be a member. And obviously the people in the community in which we work are encouraged and enabled to be members. And that it was those people in the community that funded the creation of the organisation. Essentially, they stumped up the cash to get us off the ground, and we used our legal structure as a society for the benefit of the community to enable that using a community share issue. So we, as a cooperative organisation, we bring together these sort of three constituencies to help us co-produce our organisation and to co-produce the service that we provide. And that's quite hard work, I think. It's not easy, it's not straightforward. And it's very much a journey that we're on, much in the same way as cooperation itself is a journey. People seem to think, oh, if I set up a co-op and that's it, job done, I can tick that box. But actually that's not true. That's the start of the journey about cooperating, and it's an ongoing thing. And the people that commission care are part of our network as well. I mean, and at the moment in our journey, most of those people are private individuals that are commissioning care for themselves or for their loved ones. And we are in the process of working with other organisations in health, in local government, to be able to provide services through their commissioning processes as well. And our experience of working with those people in general has been very good. They like what we do, they like our approach, and we get on very well with them. But it's not all a pleasurable experience. It can have its issues and challenges. So I just wanted to flag up a couple of points on that, really. And one of them was about procurement. So procurement is a strange creature, and we've found it really quite challenging. We've started the process of trying to get onto procurement framework with our local authority. I think we started that in last autumn, maybe September, I think, and we're not there yet. Where are we now? It's mid-March. Well, hopefully by the end of this month we might be on the framework. I've heard positive signs, but it's been a slow and painful and difficult experience for us to do that, and that's been quite disappointing, because the people on the other side of that procurement barrier, the people that we talk to in the local authority that are commissioning care services, they really get what we're about. They really like what we're about. They really want to work with us. And so we're sort of finding ways around this procurement barrier in some ways to work with them. But I know that in other contexts, in other local authorities, in other areas, because I speak to people across the country around these sorts of issues, that it can work. It can be different. And I was chatting to somebody yesterday from a local authority in London, and they do two really very simple things to help address these challenges. So the first thing they do is they actually proactively work with small new organizations that they want to work with to onboard them onto the frameworks. They handhold them through the process, which I think is a really simple and straightforward thing that can easily be done, because they've designed the process, so they understand how it works. We're looking at it from a sort of a service provider end, and it all looks a bit like a black box to us. But they know what's happening inside the box, so they can help us to jump through that hoop. And the other thing that they do is that once you're onto that framework, they then break down their contracts into little consumable chunks. And that has two really important benefits. Firstly, it gives them a lot more flexibility, because they're operating at lower levels of spend, lower levels of risk. And so they've got more wiggle room to work with providers and deliver better services as a result of that. And it also enables smaller new providers like us to actually bid successfully for those bits of work. So it strikes me that those two things are really, really simple and straightforward, and I would hope and encourage all commissioners to look at those sorts of challenges and those sorts of solutions, because I think that they're both really valuable. And I was on a meeting of our board of directors last week talking about this, and one of them has been out of the country for a few months because that's what they do, part of their work. And they said, but I don't understand, why hasn't this happened? When I left, you were talking about this being an imminent decision, and it was all just about to happen, and here we are 6 months later and it's still under discussion. It's crazy. So that's been a real challenge for us, and it sort of needn't have been there, I think, and so it's a bit of a disappointment. But yeah, life can be better. So I think if we're talking about co-production, I think it's really important that we think about co-production right across the supply chain, and go back to that idea of building a care commons that, including everyone in that process. So that's not just about the people in receipt of care and the people providing care, but it's also about the community around those people and around the organisation. Because I think that can really add some value if it's effectively leveraged, which brings me on to my final point, which is about the problem of money. We know that our approach delivers a high quality service. Our users, our service users tell us that. Everyone we talk to tells us that the service that we provide is great. We know that our professional caregivers like working with us. And we know that co-production adds value to what we do, and our cooperative methods are great. But it doesn't solve the underlying issue that there is not enough money to make it work sustainably. I should have written that in capitals probably, but there is not enough money to make it work sustainably. So we're in a situation where we have to look at each piece of work that comes our way and say, can we afford to do it? Because it's a real challenge. So. And I don't think that, no one's in a position to be able to solve that problem. But I think if we're serious about making real change, real systemic change in social care, then we need to address that problem. And I've not seen anything coming out of central government over the last decade that goes anywhere near addressing that challenge. So it sort of comes back down to other approaches, I guess, that can help us start to tackle that problem. I'm looking forward to some discussion in the Q&A, so I'll end there. Thank you.
Thank you, Graham, and thank you for all our speakers. It's shared a lot of insight and a lot of knowledge. It's also raised equal number, if not more, questions as well. So it's been really rich discussion, and it's something that TLAP, I know, will be poring over and working out where we take the information and how we begin to address some of the questions and challenges that have been posed. So thank you very much for sharing your experience and insight. The next part of the agenda is open Q&A. So we're going to sort of turn the presenters into a panel. And thank you for everybody who's been sending questions in today, and also some people who sent it in at registration as well. There is going to be far more questions than we're going to possibly cover in the time that we have available. So we're just going to run through as many of them as we can. But anything that we aren't able to cover today, we'll try and make sure that we get people's thoughts and views in and share that in the notes as well. But it may well equally feed into sort of follow-up sessions and follow-up discussions and workshops too. So thanks. So I'm going to go straight into it. I shall start with a question. So there was one that I was going to find. Yeah, there's a question particularly around co-op specific question. It's from somebody who says they find it hard to engage with commissioners, and what's the best way to inform them of what they're doing and finding out if it's of use to them. So I guess that's some of the provider end, but also sort of how do you open up people's understanding, awareness that there are different models out there, and how do you make that link and that connection, meaningful engagement with commissioning that's going to lead to some changes in terms of practice and scope of what's commissioned. So I guess I'm looking towards Jonathan and Graham on that. In terms of from your own experience, how did you first get that new ideas, the new thinking? How do you make that connection with commissioning?
Shall I kick off?
Absolutely.
I think from our point of view, we were very lucky and continue to be very lucky in that our initial steering group included a local councillor when we first started the whole development process, and so that opened a lot of doors for us essentially within the local council. and we were very easily able to speak to senior commissioning officers at the local authority, and that dialogue has been extremely helpful. So I guess my advice would be to, if you're looking to start a new cooperative organisation, then get someone with some power and influence on your steering group early, and they can open doors for you. And that, we're very lucky now. We've got on our board currently, we've got a former director of adult social care, who's retired now, and their insight, obviously, and knowledge and connections are invaluable to us. And we've just successfully elected a new councillor onto our board as well, so that we're well hooked into the power structures, essentially, which is great.
Thanks, Graham. Did you want to add anything to that, Jonathan?
No, I think Graham is much better positioned to talk about how that's worked than I am from his involvement.
And there's a sort of probably this is a question directed to Graham as well, although Jennifer and Kate may well be interested or have something to contribute to. Someone's really interested in how care co-ops and the approach to care co-ops really enable local people to live a good life in a way that just isn't possible when drawing on care and support from other forms of provision. Apologies for my camera cutting in and out. And can we give any examples of how the care and support arrangements were co-produced with local people? So I guess it's drilling down into people's experiences and what is it about the co-op model that makes different things possible?
Okay. Well, I don't pretend to be expert on this, the specifics of this. It's down to I think it's driven from our perspective, from our sort of structure and governance approach, through to how we relate to and train our staff team and how they view their role within the cooperative. And I think that empowers them to then develop a different type of relationship with our user members and the people that use our care services. So I think it's a systemic approach that builds the right culture across the organisation, and that, in my view, is exactly as it should be. That's what we're trying to do. But as I said earlier on, it's not straightforward. It's a learning curve, and we're learning every day on how to do this stuff and how to do this stuff well. So because it's not straightforward. But I think that's our philosophical approach, as it were, to this. Thanks,
Graham. Related question to that, I'm just going to leave my camera off because it keeps cutting in and out. It's probably very distracting. It's a question specific about co-production. So I'm looking here towards Jennifer and Kate. And it's a simple question, but a loaded question, I guess, is how do you get the best out of co-production group to co-design a new or existing service? So have you got any sort of top tips or things to be really sort of front and center in people's minds if they want to improve co-production in design?
I have. I mean, I think it's really going back to what Graham said. It's about leadership. It's about bringing in, if that's appropriate, the politicians in the area, so that you've got a buy-in from everybody. And it's about so buying that in, having a culture of co-production in the organisation. So I think it's all about outstanding leadership and acting by example. So it's co-chairing and having those relationships.
And I'd add to that it is about, you mentioned roles and people understanding their roles. And so I think bringing people in and saying, we're going to have a discussion and we're going to agree what the problem is that needs to be solved can really be quite empowering to communities, because people can have different understandings about where the system or the service is failing. So just having like honest conversations at the start and everyone having a shared understanding of the problem and and the scope and parameters of what can be done. And being honest where that might not be what everybody wants, but just making sure that there's been that discussion and people feel heard. So I think, yeah, and just being really clear with people about if they are going to come on board and co-produce with you, just being really clear what their specific role is and what the support is available to them to participate, whether that be, you know, through paying people for their time, through getting them to understand the commissioning cycle. People can't come and affect change if they don't understand the systems in which they're working in. And that can be, you know, we have a lot of discussions with commissioners who say, well, because of the commissioning cycles X, Y, and Z, but they've never had that conversation to break it down. And you were giving some solutions, Graham, in your presentation about how different commissioning models, you know, different local authorities have done commissioning differently. And I think it's about thinking about where co-production can be filtered into that process.
Thank you, Kate. And there's a question here again, is specifically on co-production. Someone has asked, I'd love to know more about how you measure the outcomes of co-production. So how do you know that it's having an impact? Because they're saying that it would seem that the approach would generate lots of social value, but how would you begin to evidence that?
Notoriously difficult to capture. I think what we see when we work with local authorities is what happens as a result of us going in and doing a co-production workshop. And I think what we're increasingly seeing is it doesn't help just to go in and do one session, you know, 2 hours workshop. This is part of a bigger plan. People have to, organizations have to kind of think about what is their approach to co-production. Is this written down? How can they support all levels of the organization to work in a co-production way and cite and buy into it? And then what happens as a result? So just a really basic example, well, can have big impact, is when we introduce the document Making It Real, which is a framework for what good personalised care and support looks like. It's made up of a series of I statements. So from the perspective of a person with lived experience or a carer, what does good personalised care and support physically, you know, actually look like in terms of things like information, how people work with them, and then a series of we statements, which is what organisations will do to kind of work in a more personalised way. And Jennifer's just holding up, it's just an example of an I statement. Could you hold that a bit closer, Jennifer, because I can't really see. So I can live a life I want and do the things that are important to me as independently as possible. And I'll just stick a link in the chat to more information about Making It Real. Sometimes when we work with organisations, local authorities, they sign up to a Making It Real commitment and setting up a Making It Real board. That's a brilliant outcome, because co-production underpins all that aspect of working in a personalised way. So it shows a real commitment there. But it can also be a very small step, just even having conversations that staff feeling like they can have permission to co-produce can be a really, really significant outcome. And then that leads to a wide discussion about how and how's it going to be resourced. I'll just pause there and see if Jennifer or anybody else wants to add anything.
I think it's sometimes the small things that change for people, just small incremental changes. And, you know, I don't know, I'm just thinking back to wheelchair services where they were commissioning the new service and they were saying they will only replace a cushion if someone has an active pressure sore. That's now been changed. So just those little things which are so important. I think it's difficult to measure on a global basis, but on an individual bit by bit basis, one can measure some of the smaller changes and the soft outcomes.
Thanks, Jennifer. When I asked the question, Graham, you broke into a smile. So I just wondered what was behind that response.
Well, I think you were talking about the difficulties of measuring things. Yeah, I think, well, it's a challenge, isn't it? and one that we're sort of familiar with, I guess. But you know, all you can do is keep doing it and keep asking for feedback and watch the trends, I suppose.
Yeah,
it's not a straightforward box tick exercise, as Kate says. You know, it's a methodology. It's a process of living and working. It's just how you do stuff, and to sort of measure how effective that is, I don't know. I think it's quite challenging.
I guess a really good outcome would be making it real statements. So statements from the perspective of people with lived experience involved, you know, in KPIs, in key performance indicators. And often we're told by the people that we work with, well, outcomes and evidence just feels very transactional. It's not really about what a good life looks like. And so by looking at those statements, it can help you to sort of bring to life some of the kind of work that you're doing by evidencing against those statements rather than just numbers.
Yeah, and I guess it's not so much about how do you prove co-production works. It's using co-production to really understand in the kind of granular detail that Jennifer referred to about what is really important to local people and turning that into tangible changes, which can then be measured. And so it's a bit like you said we did, you know, from both sides, but also then sort of what's the outcome of that? How do I feel better about what it was that we set out to achieve at the beginning? So I think it's as much about changing the concepts and the mindsets around how we measure outcomes and what that whole process is, as much as it is co-production feeling as though it needs to prove and demonstrate its value and its worth. It runs much deeper than that. It's a cultural and behavioural shift. I guess related to some of those other questions, there's a specific question around training and support. So it's asking what kind of training do health professionals and managers need in order to promote co-production? What are the early signs that co-production is taking place? And what areas or aspects of healthcare are most conducive to co-production? So 3 questions at least in that one. So in terms of what kind of, think about training, but what kind of sort of insights and support and resources might a commissioner or health professional need in order to begin to co-produce?
Well, NCAG's got a really brilliant top tips of how to co-produce on one page. It's being updated, but it really offers really practical things you should be considering at the start of co-producing in order to ensure success. I think a big part of it is just having discussions with people to organise priorities. So just having kind of like listening spaces, drop-in cuppers and chats, you know, really informal spaces where people can share their concerns, and organisations can say this is what we're thinking of at that early stage, and then just sort of shaping the agenda together really would be a really good start. In terms of training, I do think that you need a certain set of skills to facilitate groups of people who might be quite charged or quite upset about services. So I think that it's kind of shifting away from what I was saying earlier about professionals having all the solutions to kind of moving more towards collaborative working with citizens. So there's a lot of listening. There's a lot of we said, you did. There's a lot of, I guess, shaping the way that you're going to work with people. So coming up with a co-production sort of charter almost. This kind of one pager about what we mean by co-production, how we're going to solve the problem X, Y, and Z, and deciding what that is together, and then how you're going to reward people, and then what meetings will feel like. So just trying to have that all on one page and co-producing that, you know, not presenting all that to people, just working on that together, so they not only have a say in actually the actual thing that's been the service that's been co-designed or changed, but the how is also being co-produced.
That's great. Thank you, Kate. Jennifer, from your perspective, Keith, what do you look for that give you confidence that what is actually being offered is genuine co-production?
Well, I've just scribbled down, as Kate was talking, 2 different examples of 2 contrasting ones where it really works well, and the other that it's just tokenistic and they don't care. And the first one is an open culture. It's I have a specialist piece of equipment called a baclofen pump. And there you have a consultant, an elite hospital who is, others refer her as a god because of her expert knowledge. And even from the top, so she would take something small. I don't suppose she really understands the terminology. I'm sure she's never been on any training on what co-production is. And she'll take that to trust board level at the University College Hospital on behalf of patients, be it bins without pedals, so that people, something like that, which is not clinical. And she just will, and that culture is all the way down in her team. The lead nurse setting up a new clinic, will ask the patient group, will take on board our suggestions, and everything is that they can, not everything clinically can, not everything organizational can be co-produced, but everything that they possibly can is co-produced, and they are really a beacon of good co-production. The other one is tokenistic. They're probably just doing it because they want the contract. They don't listen. They don't try and get a wide range of people with different disabilities involved. They cancel meetings at the last minute, and you can't see any changes. Whereas the other one, it's self-perpetuating, because you do see the changes. They do listen, and they do what they can to make it as inclusive and match people up. So I hope that gives you some ideas, Ian.
That's great. Thanks, Jennifer. I guess there's to recognise really that it doesn't have to be difficult or complex things. It is about just being confident enough to open up the conversation, the possibility to do things together and to do things differently. It just brings to mind, I think it's Leicester, where they'd used Making It Real to begin to sort of ask the questions of local people and to really sort of understand what people's experiences were against the I statements. And so they could begin to identify where they're doing really well and where there were gaps where they needed to make changes. And the feedback was how surprised they were at some of the things that were priority and important to people. It was around the tone of letters. It was around the color of envelopes. It was about really tangible, easy steps that just by listening from the experience of the individuals, drawing on that care and support, they're able to make those simple changes. And obviously that's a very different end to co-designing a cooperative and service model, but it both are rooted in that focus on the relationships, focus on trust, focus on genuinely sharing responsibility and the power in terms of what happens and what comes next. Can I just add a quick question in here? Because obviously it relates to a question that's been posed around the self-assessment toolkit or checklist in terms of how are we doing? Is there anything that we can draw on? But I'd like to expand that question out slightly in terms of there's a lot of interest and a lot of talk around co-production, and what we certainly hear in TLAP is people wanting to do it, but not necessarily know how to do it. So obviously TLAP has some resources, Sky has some resources on Sky, but is there any other sources of that kind of confidence building, practical tools, resources that we can highlight today that people can sort of leave the call and go straight and have a look and immerse themselves a bit in co-production?
I think Sky's how I mentioned NCAG's top 10 tips to co-produce, and I've stuck that in the chat. Sky have got a really good what is co-production in social care and how does it work document. I'll try and find a link to that as well. But I think the top tip I'd give is to go back to your teams and try and find pockets of good practice, because I guarantee co-production will be happening. You just might not know about it, and just trying to sort of find out what's working where and what you can learn before thinking about how you embark on co-production within a co-op. And Jennifer, did you want to add anything?
No, I think you've covered that.
Yeah, just to add in there, I think that people will sort of naturally do this if you let them, and a lot of it is about just sort of giving them permission, really, and empowering them to start having those conversations.
Yeah, great. Thanks, Graham. And I guess the flip side of that question is, where can you go to get more about the co-production side? Graham, have you got any suggestions in terms of where people can go to learn more about cooperative movement? And you mentioned your models, be it you designed with the intent of it being replicable. Where can people go to sort of really get into the detail of what you're doing in Kirklees?
Well, I'm very happy for people to get in touch with me directly, and there's also we set up a website, which I'll put in the chat, the address for that, which sort of sets out some of the stuff that we've done, and obviously, and we're very keen to develop that further. And make that more of a sort of a community resource, really. So if people want to contribute to that, I think that's the address that I'll just put in the chat there. So we're in a situation where we're in the early stages of trying to establish a sort of a network, a sort of community of interest around cooperative care across the country. And we're talking to maybe a dozen groups across the country at the moment that are in various stages of development, and trying to sort of move that along. So if people want to get in touch, we can sort of hook you into those dialogues, really. I'm very keen to talk more.
And Graham and Jonathan, I loved your slide about your vision for adult social care in Kirklees, because you sort of showed how you did it, what's important, but you did it all on one page. So it'd be good to maybe share how you did that, then the co-production within that, and then you can maybe come up with something similar for co-production within a co-op.
Yeah, that'd be.
Yeah, I can, and I can talk to colleagues to get some of the materials that we can share on that specifically.
Yeah, because I think your point, Jonathan, about setting this in the context of the whole, rather than looking at specifically just for co-ops, I think it is really key to getting that buy-in and that leadership support in local areas. That'd be really helpful. I'm going to have to call an end to the panel and the Q&A session. We've got through an awful lot really efficiently, actually, but there are a few questions, so apologies for people who haven't heard their question aired in the session. As I say, we will make sure that we go through that and cover off the questions with answers, hopefully, in the materials that come out following today. I just want to also thank everybody for really amazing use of the chat facility and all the great insights, resources, connections that I haven't got it open, so I can't see it all. I just get the occasional one. I'll get them popping up one at a time. But it seems like there's layers and levels to today's event, and it's been really, really rich. So a lot of people asking, will we be sharing the content from the chat, and we'll make sure that all those links and resources, as well as the ones that the panelists have referred to and mentioned, are shared to everybody, so you can sort of pick up and continue the work. Just on that point, this is a project that's funded by Co-op UK and Power to Change, and there's probably 3 or 4 more webinars that are looking at different aspects of sort of building blocks towards setting up cooperative models for home care, domiciliary care. But beyond that, because of the level of interest and the richness and the amount of opportunity to bring people together to share that knowledge and understanding and move things forward, TLEP are going to commit to continuing this work on beyond that project. So what we're shaping up to do is to bring this into some work that we already do around different innovative community-based personalised models of care, which you may be familiar with in terms of an innovation rainbow, and we'll make sure we have the links to that. But you can look at, if you go to the TLEP website and type in innovation rainbow, it will come up with those resources. And what we plan to do next year is to take that resource, which is a directory of really good innovative interest, ways of delivering care and support, and turn that much more into a network. So we'll be working with those organisations on the rainbow, but practically seeking or practically connecting that to commissioning and people involved in procurement, and seeing whether we can get some of that collaboration, innovation, co-design, co-production around really understanding the challenges and where we can make real genuine progress. So the network and the work that you mentioned there, Graham, in terms of trying to build that momentum and that network and community of practice around co-op specifically. It'd be great to link that into some of the plans that TLIP have going forwards.
Yeah, I'm pretty keen to talk to you about that, Ian. That'd be good.
Brilliant. So yeah, today expect a video from today. We also include the PowerPoint slides as a separate attachment. There'll be lots of information that's come up from the chat, and we'll try and cover off everybody's questions as fully as possible. To make sure you keep informed and aware of what's coming next in these series of work, and also the network I just spoke about that's coming next year. Do sign up to TLAP. If you go on the website, and we'll add the link as well in terms of signing up. Make sure you're on our mailing list. But other than that, I just want to thank everybody for today's contributions, both from the panel, but also, as I say, from the chat as well. It's been an excellent session. So thank you very much.